which of the following is most appropriate treatment for this patient's condition? Okay, so it's a treatment question. So, 45-year-old woman presents to her primary care physician with a 4-month history of fatigue, pruritus, and xanthomatosis lesions on her eyelids. She also reports recurrent episodes of right upper quadrant pain. Lab tests reveal elevated alk phos, GGT, and bilirubin. Serological tests show the presence of anti-mitochondrial antibodies. Okay, which of the following is the most appropriate treatment? All right. So GGT I usually think of with alcohol. Alk phos could be a few different things. Right upper quadrant pain, I'm usually thinking of something to do with the gallbladder. She has fatigue. She has xanthomas, so she's probably producing like a lot of cholesterol. So let's see, which is the most, and it seems like she's in a like an autoimmune patient as well, with presence of anti-mitochondrial antibodies. Which is my most previous condition. Ursodeoxycholic acid, I cannot remember what that does. AZA, I think it's going, that's in like the 6, is that 6MP or AZA? Just doing something about that the other day. That might be in like the uric acid pathway, I can't remember. Prednisone's going to be the steroid. Penicillamine is not penicillin, I can't remember what it does. And then phlebotomy would just be like, giving phlebotomies. I know it's not phlebotomy. It's for like a hemochromatosis. The only condition I know that for phlebotomy. Of all these things, it seems like this is the first. If this is the first complaint, it seems like a steroid would be the first thing to choose. But I'm not super confident.
Sure. Oh, that's the
In
thing that
going
I
through all
forgot to
these.
talk to
Okay.
you about. Totally forgot.
Okay.
Okay. How confident do you think when you're answering step 1, step 2, step 3 questions? How much of the information do you think you need to know to get the answer right? This is a mentality thing that I want to change. That's why I'm
I'm
mentioning.
not sure. I always think I need to know like everything in it to get it
Okay,
right.
exactly. So that's the reason why that I want to mention that. You actually don't need to know everything. Okay. If you put
Okay.
everything in a clinical setting, you only need to know about 60, 70% of the information, right? To deduce a
Okay.
good answer. And how confident do you think you need to be on a question, right? Like to get it right, that is. Do you need to be 100% every time?
I don't think that's, I don't think anyone's
Yeah.
100%
So
confident in
that's
all their
that's something that
choices.
I
So,
also want you to remember too, right?
okay.
In medicine, right? Nothing's 100%, right? Even when I like, you'll
Okay.
start to, the more questions you'll do to me with me, you'll also realize
Mhm.
I'm never like, oh, I'm 100% sure it's prednisone, right? I would never say that.
Okay.
I'd say, oh, okay, if I were to choose here using my context clues, I'm about 70% sure that's this. And you might be thinking, how the heck is my tutor only 70% sure? Well, that's why I'm trying to
Right.
explain to you, right? That
Okay.
medicine is not like, it's not, it's you're playing odds, right? Like I'm saying, right?
Okay.
You're saying that's why they say
Mhm.
what is the best answer choice, right? So in this question, this is not really fair for step 1, right? So I wouldn't put too
Okay.
much pressure on this question because there's not
Okay.
really, well, actually, sometimes a lot of like step 1 questions might say like, I guess most appropriate treatment is fine, but next step in management and stuff like that is not. So I like your thought process so far, right? You know it's an autoimmune
Okay.
disorder, right? You know that it's
Yep.
liver and gallbladder, so it's biliary tract, right? You know there's a
Mhm.
cholesterol buildup, right? You know that there's pruritus and
Yes.
things like that, right? So itchiness. So you know that it's in the biliary tree that's causing these issues. Okay. So you've gotten rid of phlebotomy because you're like, okay, maybe that's for hematoma right? Um,
Hmm.
and right now you're thinking prednisone because that's right now maybe a safe bet because it's autoimmune. So I'm liking your thought process so far. Do you want to
Right.
keep it or change it? Now that's the question.
Um, EZA, I'm not sure if that's a first line. I can't remember what that's first line for, unless it's a DMARD thing. the first answer choice, I don't know what that is, so I wouldn't choose it because I don't know what it is.
Okay,
And
good.
then penicillamine, I should know what that is because I've heard it before, and I just know it's not penicillin. So I've been tricked by like, oh, it's not penicillin, it's something else.
Okay.
So I think I would stay just because I don't know how I could do something else.
Okay, so let's
But
let's
okay,
talk
it's
about
the
this,
first
right?
one.
So primary biliary
Okay.
cholangitis is going to be your diagnosis here. Okay, and that's because the
Okay.
antimicrobial antibodies, and if you remember what this does, is it kind of scars down the biliary tree, and so what ends up
Okay.
happening is you build up a bunch of bilirubin. It backs up all the way back. Okay, if it
Okay.
backs up all the way back, the best way is so this urideoxy acid is first line treatment, right? It improves liver
Okay.
function, symptoms, and the way, if I remember correctly, is it helps secrete more bile, if I'm not mistaken, but you might have to look at the mechanism. I forget.
Okay.
Um, azathioprine, right, is immunosuppressant, right? So inflammatory bowel disease, rheumatoid arthritis, autoimmune
Mm-hmm.
hepatitis, right? Doesn't really help with PVC. Prednisone used in inflammatory autoimmune, but it's not first line. Maybe
Okay.
combination for autoimmune hepatitis. Penicillamine is for Wilson's disease, right? Which is copper accumulation, right? So
Okay.
it helps
Yep.
with that.
Okay.
Phlebotomy, like you said, right? Hematocrosis. So yeah, best answer here is
Okay.
going to be uridoxy
Prednisone. Or
folic
okay.
acid.
First one.